As I mentioned in the last section, damage to any part of the hippocampal system tends to result in similar types of cognitive deficits, and in particular, deficits in declarative memory. In 1953, a patient called Henry Molaison, who was suffering from severe epilepsy, was given experimental surgery aimed at improving his condition. This surgery involved removal of significant parts of his hippocampal system. The surgery was successful in alleviating his epilepsy, but also resulted in a remarkable combination of memory deficits. A number of other patients given the same surgery also showed similar disorders, and the procedure was discontinued. But Henry Molaison was extensively studied until his death at age 82 in December 2008. Until his death, he was known to the academic literature just as HM. His most dramatic symptom was the inability to learn any new facts or words, or remember any new events. However, his ability to remember facts and words learned before his operation was normal. And although he had a reduced ability to recall events that had occurred in the 11 years prior to his surgery, his recall of more distant events was again normal. His ability to understand and use language was also normal, subject to his inability to learn any new words. Furthermore, his working memory, including recall of events within the previous few moments, also appeared normal. So, if you met him, you could have what seemed to be a normal, intelligent conversation. But if you went away and came back a few minutes later, he would have no memory of ever having met you. He could still perform all the skills he'd learned prior to surgery, and could even learn new mechanical skills if they were fairly simple. For example, one test was to get him to use a pen to trace a figure, while the figure, his hand and the pen were only visible in a mirror, the mirror tracing experiments I mentioned earlier. This is quite a difficult skill to master, but over a number of training sessions, HM improved at a normal rate. But of course, he had no memory of earlier training sessions, and each time he tried mirror writing, he thought it was the first time. And after one later session, he commented that he found the task much easier than he expected. But he couldn't learn more complex skills that perhaps required some declarative memory. His primary memory was completely unaffected. Remember that we pointed out the range of subcortical structures that are strongly interconnected with the hippocampal system. Well, damage to the anterior thalamus, or the septal nuclei, or the mammillary bodies leads to a very similar combination of memory deficits. And even damage to the fornix, which links these structures together, has similar effects. Damage to the amygdala has a somewhat more subtle memory effect. If we're in a highly emotional situation, say we're witnessing a crime, we tend to have an enhanced memory for the essential overall factors in the situation, what's sometimes called the gist of the situation, although there's no enhancement to our memories of, say, specific objects that were present. Damage to the amygdala means that we no longer gain these enhanced gist memories. Another interesting set of observations was that damage strictly limited to CA1 results in strong deficiencies in the ability to learn new facts or events, but no measurable effect on pre-existing event memories, even the most recent. Thus, for tasks requiring new declarative memories, like recalling a new story or diagram, RB, a patient with that kind of damage, showed clear deficits. But in recall of past events from the recent to the distant past prior to CA1 damage, RB's performance, as indicated in red, was as good as the normal controls in tasks like recalling or recognizing public events, recognizing TV programs or famous faces, or recalling personal events, In all of these, his performance was as good as, and sometimes better than, people with no brain damage. The hippocampus appears more active during novel experiences. Experiments have looked at hippocampal activity when subjects were viewing photographs of complex indoor and outdoor scenes. The red areas are those in which there was higher activity during viewing of the novel photographs compared with repetitive viewing of familiar photographs. And in this diagram, the hippocampus has been conceptually unwrapped, so that you can see the activity in different areas separately.